Pfizer today insisted their coronavirus vaccine deliveries are on track, hitting back at Matt Hancock after he warned supply issues would slow down the rollout this week.
The health secretary claimed a delay in the supply schedule will result in fewer jabs being dished out. But he also said there would be some bumper weeks in March to make up for the lag.
Both Pfizer and AstraZeneca, manufacturers of the jabs currently deployed in the UK, say there is no issue with deliveries.
Pfizer sources today told MailOnline there were no supply challenges and deliveries were arriving as planned. AstraZeneca yesterday admitted there were fluctuations in supply at plants, but that it was still on track with orders. Official figures showed Britain only administered 150,000 vaccines on Sunday, in the worst daily performance since the NHS rollout began to gather speed last month. The number of first doses dished out has dropped by 40% week on week. With a rapid inoculation drive crucial to Britain's hopes of lockdown being eased in the next few months, critics say there is no excuse for the rollout slowing down.
Think tank bosses believe it is unlikely supply is solely behind the downturn, because there would be reports of centres across the country running out of stock, which hasn't been the case.
Boris Johnson put a successful vaccine rollout at the heart of his lockdown easing plan, which he unveiled yesterday. So long as the operation continues successfully, all restrictions could be dropped in England by June 21st. Any hiccups could threaten the target.
Britain is racing to give as many first doses to over 50s as possible before the end of March, when millions of second jabs must be rolled out, which will inevitably slow the operation. The PM has pledged to jab all 32 million in the top 9 groups by April 15 and every adult by the end of July.
COVID vaccines being used in Britain are working spectacularly well in cutting hospital admissions caused by the virus by as much as 95%, according to the first real-world evidence of the rollout.
Researchers yesterday called the results very encouraging and claimed they provided compelling evidence that they can prevent severe illness. Scientists counted COVID hospital admissions in Scotland among people who had had their first dose of a jab and compared them to those who had not yet received a dose of either the Pfizer or Oxford/AstraZeneca vaccine.
In a ray of hope for Britain's lockdown easing plans, results showed the jabs slashed the risk of being admitted to hospital with COVID by up to 85% and 94%, respectively, for weeks after a single dose.
The study, carried out by academics from the universities of Edinburgh and Strathclyde, as well as Public Health Scotland, was the first of its kind. But it currently doesn't have enough data to analyze how well the jabs prevent death or stop transmission of the virus.
Lead researcher Professor Aziz Sheikh said, "These results are very encouraging and have given us great reasons to be optimistic for the future. We now have national evidence that vaccination provides protection against COVID hospitalizations."
Rollout of the first vaccine dose now needs to be accelerated globally to help overcome this terrible disease.
With the UK anxious to rattle through its vaccination program to stem the flow of COVID deaths and allow lockdown rules to be loosened, ministers have been forced to defend the pace of the rollout as its speed goes through peaks and troughs.
The government has repeatedly blamed lumpy supply and the need to wait for manufacturers for holding back the UK's rollout, as both Pfizer and AstraZeneca had to reorganize their factories in January to scale up their plans.
Ministers have yet to receive any supplies of the other jab approved for use in Britain, made by Moderna, although this is expected to come within the next couple of weeks.
But there are also issues with the rollout process, which is also holding the NHS back from hitting its maximum pace, with it already proving it can do almost 600,000 per day.